So thanks everyone for coming. It was really interesting this morning thinking about what Terry said in terms of the generational divide, because I think online dating is something that really generates a lot of discussion among different generations. And so I'm interested to know what people think of that. But also thinking about the role of narrative in doing health research is really useful, and so that's what I'm presenting today. So I'm presenting to you some research I did in San Francisco in the summer, where I talked to some gay men who used online dating sites, talking to them about sexuality and HIV. And so I'm just sort of presenting some of my preliminary findings. So for me, I think it's really interesting to think about sex and health and technology in this way, because you can generate really interesting discussions with people and sort of maybe generate new ways to think about health. And so there's been some literature that's come out since the 2000s to suggest that the internet is this risk environment where people go to engage in riskier activities, but there's never really been any conclusive evidence one way or the other that the internet per se causes these behaviors. And I think it's a lot more complicated now to talk about, because you can't really separate users from non-users. More people are using online dating sites than before, and also people's relationships with the technology is different. And so by that I mean sometimes people use it intermittently, sometimes people use it more often. People have different sort of life cycles that they experience the internet with. But what's been really interesting for me in thinking about this is the ways in which anxieties about sexuality get sort of placed onto technologies. So whether it's anxieties about victimization of people online to the transmission of STIs and HIV. So here are some examples of some headlines that I was able to gather from the internet. So I don't think that some of these concerns are entirely unfounded, because I think that technologies do have material implications for health. So I think what we do online does matter. But I'm concerned about the ways in which there's this tendency to simplify technologies in terms of cause and effect. And it's really interesting because when you look at these headlines, the content usually isn't that sensationalistic, but the ways in which we kind of deploy this rhetoric is very interesting for me. And so, while it's true that we have these concerns about HIV and STI rates, particularly in the US among young men of color, we're also aware that inequities in health are rooted in a network of sort of complex factors. And so, the internet is like one of many things that we would have to address. But public health has sort of taken an active role in using new media technologies in terms of it being lower cost, being able to have great reach, and being able to be tailored. So there have been sort of different innovations, text message testing, reminders, apps to sort of improve medication adherence or whatever. But when it comes to other sort of prevention activities, so using like internet partner notification services like InSpot, or sort of creating sections on online dating sites to sort of disseminate information, they've been less effective. And so this promise of technology hasn't really lived up to the expectations. And so I think part of the reason why this happens is not necessarily because we need newer and better technologies per se, but because I think some of these interventions are good at perhaps addressing some behavioral changes, but perhaps not changes for the long term, addressing sort of structural and environmental factors as well. And so I think that the internet can be part of it, but it's not this sort of magic bullet or a panacea for all these other issues that we have to address. And meanwhile, there have been some ways in which the internet has been really useful. And I'm thinking about the meningitis outbreak in New York City last summer among gay men. And so maybe for some gay men who might not be accessing other modes of information, having these apps can be really useful for sort of distributing quick information maybe. And so what I'm here to talk to you today is not about sort of, how to use technologies to kind of fix health problems, but rather why we should be thinking about the ways in which people negotiate identity and sexuality and interact with each other as a useful kind of route to think and reimagine health. I think, we need to sort of reimagine, I guess, prevention messaging, and so perhaps this might be a useful way, but I'm not sure. So based on my interviews, one of my sort of initial kinds of, I guess, assumptions was that the internet would be really important for everybody in identity formation. And so I talked to men in San Francisco about this. And I found that it was more about which life stage they were kind of at in terms of coming out. So for men who had come out a little bit earlier in life, I think the internet was really important for them for connecting. So this is one participant I talked to, and he was talking to me about gay.com, if anybody remembers gay.com. So, you know, for him, it was this connection to the gay community. And my participants that came out when they were a little bit younger, they talked about, you know, maybe being the only gay kid, and so the internet was a great way for them to sort of make friends. But for other people, there were other media influences that were important. And so it wasn't necessarily the internet, but television. And so it was really interesting to talk to some people who would talk to me about, you know, shows like Project One Ray and Queer Eye, or also Queer as Folk, as being important. So I think when we're thinking about media influences, the internet is one, but there are still traditional outlets that are also important. So for the most part, guys that use these sites, they talked about sites as being really convenient, efficient, and frankly cheap. But some of the main things that kept emerging for me were, and that I saw, were chatting and sort of community. So for some participants, chatting online functioned to sort of reduce loneliness, alleviate boredom, and kind of enhance or fill a need for fellowship online. And for other people, they felt that having online tools actually helped them enhance their sexual communication with each other. For some people, they felt that they had been hiding their sexuality for so long that it was nice to be able to have a place to discuss this with other folks. And I think another theme that emerged was this idea of the community. So depending on who I talked to, there was the idea of, you know, the community being the village, and so they're talking about the Castro here, right, of 18th and Castro. But for some people, also depending on where they came from, and this kind of relates to what Nathaniel was talking about earlier, this idea of the Mecca, right, this large center. So this participant over here felt that online dating sites were really helpful for him because of the sort of close-knitness of his environments. And so he always felt that it was sort of hard to break out of social circles where people hadn't been sleeping with each other. He wanted something new. And for other people, and people that had come from perhaps smaller urban centers, the gay community seemed like this big thing, and they didn't really know where to get an in. And so online sites were helpful for them sort of learning how to navigate while they're new in the city. I think one of the most interesting things I found was actually the ambivalence, the sort of ambivalent feelings that men had about sexuality on these sites. So for some people, for example, like this participant, he sort of really resisted what he felt was a really like hypersexualized gay culture on Grindr. For him, it was a bit too much. And so he really preferred things like Tinder. I don't know if everybody knows what Tinder is in this room, but it's an online dating app, and it connects you through your Facebook friends. And for him, it was, you know, more vanilla. He described it as more vanilla, and that was something he preferred. But for other people, they sort of felt like online dating technologies allowed them to kind of be participate sexually in the community without having everybody know. So they really valued that kind of privacy. And so for some people who were perhaps less extroverted, online dating platforms help them also alleviate some of the anxieties around social interaction. So a number of my participants talked to me about how hard it was sometimes to sustain conversation with people, to just go up to somebody and just talk to them. Or, you know, in the context of being at a bar, if you're drunk, it's hard to just sort of go up and have this fabulous conversation. And this ambivalence kind of continued in the ways in which people really valued the convenience of the sites, but also a number of them talked to me about feeling like they were being kind of lazy at the same time. And I think talking about removing the human element was another common theme, that it was just, it just became so easy for them to do. And so when I talked to some of the men as well about HIV prevention online, I also found that there was a lot of ambivalence, and it really depended on who I talked to. So this participant in particular, I asked him what he wanted to name himself, and he said Sweet Tooth, so I went with it. Anyway, so for him, he was somebody that was more committed to the condom code of HIV prevention. And so for him, it really bothered him having to negotiate when he would meet online with people, having to negotiate people that maybe didn't really agree. But then for other people, they sort of, express this ambivalence, right? So this participant talks about, you assume you can tell a gay guy to wear a condom, and he'll be like, oh my God, thank you. Thank you for telling me that. I hadn't thought about it. I'm gonna do it right now. And so for him, he's someone who, ostensibly knows what he's like supposed to do, but he still found himself like really struggling a lot. And so, we have this idea, I think, of people being rational actors and sort of negotiating this in a situation that's highly passionate and, difficult. So, ripping yourself out of the moment and being like, you are being crazy. And so when I talked to some of the guys about, what they thought about online interventions on dating sites specifically, they also expressed similar ambivalence. So this participant puts it perfectly, saying that, HIV prevention on these sites is a bit of a mood killer for him, right? And so, when I talked to a lot of them, they were like, well, whoever looks at, Grindr for Health, or whoever looks at Manhunt cares, right? It's a little bit of a buzzkill. And I think also for some, they also felt that some of these messages were a bit intrusive into the kinds of lives that they had. So this participant talks about, as a community, having so many outside sources telling us, getting into the very private part of our lives. And so on one hand, he feels like it's been necessary, but on the other hand, he just thinks like, okay, get out of my sex life. And suggesting that, if he really wanted that information, he'd be looking elsewhere and not on Grindr. And I also found another interesting theme which talked about the politics of serostatus. So a number of sites have the disclosure of your serostatus as a way to help maybe some people decide their level of risk or reduce their risk. But it was really interesting because the ways in which HIV status was talked about was also some of the same ways in which other kinds of discriminations and stigmas happened online, whether it was related to race or whether it was related to gender policing or to body policing. So this participant here was really put off by the kinds of HIV or pause phobia that sort of happened on these sites and sort of turned away from it. So I think, while we have these kind of health interventions we try to launch online sometimes, we also have to think about these unintended consequences of what happens. And so I think that's important. And so this idea that everybody will just disclose online because you have a status line, doesn't anticipate these kind of problems as well, but the problems of disclosing or not disclosing. And I think a number of people just might not want to disclose at all just because they're so opposed to the idea of having to disclose it at all online. Like this is, potentially a public forum. It's not really that kind of clandestine. And so some people, don't want to participate in it that way. So I just have some conclusions over here to finish up. So, hookup sites or online dating sites or whatever, they house diverse groups of people who have diverse needs and motivations for being online. So when we're thinking about people online, there are people that are looking for chat, there are people that are looking for friendship, there are people that are looking to have sex, and all of those are great. And so I think we need to sort of acknowledge and empower those as well. I think that, we need to really capture this ambivalence about sexuality and HIV prevention messaging as well moving forward. Acknowledging the roles of chatting, connectivity, and forming community online and sort of what people are looking for when they're there. And then finally thinking, is it useful or is it possible to move from sort of one-way informational models where we just give people all the information we think they want online to more kind of dialogic, so two-way communicative models of digital prevention? I mean, if that is even possible. So I'm ending early, so yes, thanks.